Hi, today I want to talk to you about vitamin D, vitamin D3. So most of you all are probably familiar with how important vitamin D3 is. Well, I'm excited that we now have vitamin D3 with vitamin K in it. So both of our vitamin D supplements, we have a liquid that I'm showing you here, but we also have a gel cap, and both of them now contain vitamin K. And you might be wondering, well, who cares? Well, what we have realized over the last coming years with everybody talking so much about vitamin D and its importance, and if you aren't familiar with it, it regulates a gazillion reactions in the body. It's really considered more of a hormone than it is even a vitamin because of its actions in the body, particularly its immune function in the body. And so vitamin D is extremely important. And what we're realizing is that people were getting on the bandwagon and taking these very, very high dosages of vitamin D. And then what was happening is that calcifications were beginning to happen within their body. So we need vitamin D for bone health, but sometimes what was happening is in, say, the artery lining, that calcifications were starting to happen and not actually going to bone growth and bone health and also immune function. So in order to prevent that, vitamin K is there to help with the bone growth for vitamin D and also help promote the various reactions in the body. So it's considered a much safer form now and better to take, particularly when people are starting to take these really high dosages of vitamin D. So our liquid has 2 drops equals 1,000 units. I find that most people, at least in my clinic, and of course I'm checking people's vitamin D levels all the time, and I like your level to be somewhere between 50 and 70. So the reference range is between 30 and 100. So when your doctor says your labs look fine, your level's normal, definitely get a copy of your labs and take a look, because some don't look at optimal levels. They're just looking at normal levels. So between 30 and 100 is normal, but optimal is between 50 and 70. So depending on your level, you'll need to figure out how much you want to take. I find in my clinic, most people are needing about 5,000 units. Some people need to start at 10. And it's better to take it on a daily basis than it is to take these big, gigantic, 25,000 units all in one day, or 50,000 units. There's a prescription vitamin D out there that's 50,000 units, and it's a pill that you take once a week. Our body's not used to getting that much vitamin D all at one time, so I do think it's a supplement that's better to be taken every day. Now, something to know about vitamin D is it is a fat-soluble vitamin. So the good thing about that is if you miss a day, you can just double up the next day. However, the bad thing about a fat-soluble vitamin is it can be toxic if you get too much. So definitely when you're getting over about 2,000 units a day, I would want you to make sure you're getting your levels checked every couple of months by your doctor or through a standalone lab so that you're not getting toxic on your vitamin D. Again, the liquid has, in 2 drops, it's 1,000 units. So if you were taking 5,000, you'd get 10 drops a day. And our gel caps are actually 10,000 units in each cap. So you would only, want to take that every other day, or depending on your needs, if you were somebody who needed that high of a dose, you'd take it once a day. I do think it's fine to do something like that if you prefer a pill over a liquid, that you can take it every other day, but you definitely just don't want to stack up and take really big dosages like 50,000 on any given day. And irregardless of where you get your vitamin D, please make sure that you're always getting it with vitamin K now.